everyone, or Assalamu alaikum. It's so good to see everybody. First of all, I know it's been a while since I've done a video either myself or with Dr. Hussein, so I definitely want to say to everybody, Eid Mubarak for both, I guess, Roja Eid and Qurbani Eid. I feel like it's been a while, so I'm really glad to be able to come back to say hello to you all and talk to you about a few things. I hope you all have been healthy, doing well. I know there's this new Delta variant, which, you know, in coming sessions we'll talk to you all about that too. But I hope you all are safe and healthy, you and your loved ones. So just to get right into it, one of the things that I wanted to talk to you all about, well, first of all, just to dial back a little bit, I am an obstetrics and gynecologist. So I trained for 4 years in general OBGYN, so pregnancy related, non-pregnancy related, well woman care, all of that. And now currently I'm exclusively specializing in female pelvic medicine and reconstructive surgery. I'm in fellowship. I'm finishing that up right now. This is my last year. And just to like it's a very broad term, female pelvic medicine and reconstructive surgery. It is broad. Our scope it's interesting, both narrow and pretty complex, and I'm happy to talk to you all about it in the days and sessions to come. But one thing that I find is pretty neat is that my field or my focal area of expertise right now that I'm building is, I feel like allows me to provide care for women in a marriage that is right between obstetrics and gynecology. So it's not just like delivering baby and it's not just gynecology, it's like right in the middle. And that is what happens to all of the pelvic floor muscles after childbirth. So I definitely want to take a little bit of time to really talk to you all about it. I am so grateful to her will and this community to have this platform, because I feel like oftentimes, especially when it comes to just honestly, like even general gynecology, basic tenets is so many times missing. That education piece is so many times missing, and for so many women in our community, like Amadirma, Chachis, and all of them. But I think especially when it comes to pelvic floor stuff, and I'll tell you guys exactly what I mean when I say pelvic floor. It sounds fancy, it's not really. And I think that oftentimes, if there's any education on this, it's kind of like always swept away, because so many things, especially in our culture, is all about like you live with it. I'm here to tell you that, yeah, but there are two specific conditions that I really want to make sure that we all at least know about. They are oftentimes, not always, oftentimes related to pregnancy and motherhood. However, just got to say that just because it's happening doesn't mean you absolutely have to live with it. So the most important things from our end is to empower you to be your best selves before and during motherhood, so that you all stay well informed and always have enough information to make the right decisions. Okay, so I'm going to go ahead and get started. I first want to talk to you about just childbirth in general and how it relates to the pelvic floor muscles. So I have here, I think you can see my cursor moving around, and I'm super glad that this is being recorded. But basically, if I were to cut somebody in half and like take a look from the side, just to show you, this is that bone that you have in the front, this little thing here. Then right behind it is the bladder, okay? Right behind that is the uterus, and behind that are the intestines. So the uterus, this is where the baby grows, and then it's through here, the vagina, that the baby actually passes. So let me show you, I have a real life diagram too. Okay, so if I'm looking from the top, okay, this is the bladder, all right? And it's like, that's like the first thing we encounter. A lot of people don't know that. So bladder, uterus, this is where the baby sits, okay? This is where the baby is. And can you imagine, like, as the baby grows, how much pressure it puts, that uterus then puts on the bladder? We'll talk about that too. And then right behind it is the intestines or the rectum. We won't talk too much about that in this session, but I'll talk to you about it later, okay? So essentially, these are all, and also the other super important things that I wanted to talk about is that there are ligaments here, these blue things. There are ligaments here that actually, what they do is they support all of these organs that you have here, the bladder, the uterus mainly, but also the rectum. They stay supported up because of these ligaments down here. That's why you don't, when you walk out like down the street, you don't just see see or experience anything falling out. All of these muscles here is called the pelvic floor. They're actually lifting everything up. And a lot of people don't know that, but anyone who watches this video will. So I'm super excited, okay? Okay. So now that I got you guys a little bit oriented, let's move on. The first thing that I want to talk to you about is stress, urinary incontinence. So stress, not like the emotional stress, although that can cause a lot of body changes too, and we'll talk about that in another session. But I'm talking about urinary incontinence, which is a fancy word for leakage when you don't want to. So having accidents, like accidentally passing urine because of some sort of strain, like laughing, coughing, or sneezing, some sort of activity that is causing your bladder to have some pressure that all of the muscles down below no longer can withstand. That's when you have the leakage. So let me show you. Up top here, this is a photo or like a drawing of a normal bladder. And so you see this woman here. Before I even go into this, look at this woman. She like coughed or sneezed or something. It looks like she has a cold. And unfortunately, she like her pants are wet. So she had an episode of leakage. So just to sort of show you from a diagram perspective, when this happens to her, what is happening in her body, you know? So a normal bladder. This is the bladder. All of this like orangey, it looks orange, but it's supposed to be yellow colored stain is urine. And this is the urethra, which I'll also show you in the diagram too. That the urethra is the tube that connects your bladder to the outside world. Okay. When there's pressure against the bladder, the muscles around the urethra are not strong enough. So they just are not strong enough to keep the urethra closed. So guess what happens? You leak. This is a normal bladder. So when there is pressure out here, the urethra stays closed. And this is a bladder that is experiencing leakage. Pressure on the belly, so this could be like, I don't know, like coughing, laughing, sneezing, doing a squat or anything. And then unfortunately, there's leakage after, okay? So I wanna show you with this diagram what I mean. So a lot of times, I don't know, I think I'm allowed to say this, but women have 3 holes down below. It's sometimes difficult to be able to clearly describe that. But basically, the first hole is here, okay? That is the urethra. That is where literally the pee is coming out from. So this is the bladder, right? This is the bladder. The pee is coming out of the urethra, okay? Under it is the vagina, and that's where the baby literally passes through. So uterus is where the baby is, passes through the vagina. And this is the rectum, and we can talk about that later. The 2 main holes I want to talk about today are the urethra and the vagina. So urethra, again, a lot of pressure up here against a bladder that is super full, a lot of pressure. This urethra down below is not strong enough to hold that urine together, and it just, there ends up being leaking, okay? Another analogy that I really like, and one of my mentors taught me this, is imagine if you're like, you know, gotcha bunny show, right? Like using this big hose. Sometimes I feel like I use a little bit of a bodna situation to water my plants, but with normal people that use garden hose to water their plants or the grass, if you take a look at this hose is going to keep firing. If you step on this hose here, it should stop, right? So what happens when women have had children, this mainly happens after women have kids, is that after the baby passes through the vagina, a lot of those muscles and ligaments that were supposed to hold things like the urethra together, get a little tired. They get a little tired and worn out, and that's what then causes for the leakage to happen. So what you want are the muscles in the vagina to act like this concrete floor, so that if you step on this hose right here, there's no leakage, right? Because your vaginal muscles are holding things together. But a lot of times after having a baby, that doesn't always happen. So what is this baby like actually doing? So I want to show you a couple of photos of, or not photos, but like diagram cartoons that actually show a baby like in the uterus and passing through the birth canal or the vagina. So this is where the baby is during pregnancy. And look, do you guys see this? I know my cursor is a little bit strange, but here, that's the bladder. So this big uterus is literally compressing the bladder. So it's totally makes sense how after having delivery, you can have bladder problems. So this is the baby hanging out during pregnancy. Takbor, when it's time for labor, it's making its way down. So the uterus or jara, right? So now it's at the cervix, and now the cervix also completely opens and the baby's coming out, right? So as you can imagine, after the baby comes out or while the baby is passing through, it's moving a lot of those pelvic floor muscles, which, you know, to be very honest, I'm surprised that there isn't more damage. It's more testament to the fact that the pelvic floor muscles that we have down below are so good at, you know, at like suffering through trauma and kind of getting back together. But what happens often is that it never comes back to your baseline. So a lot of you out in the audience will probably be able to tell me that ever since you had your like 1, 2, or however many kids, your muscles down below are not like they were when you were 18 or before you had children. So basically with childbirth, there comes a lot of the wear and tear of the muscles down below, and that's what causes things to weaken. And that's what makes it hard for the urethra, or which is the tube that connects from the bladder to the outside world. It doesn't stay sturdy. So it's supposed to have these sturdy muscles. Pretend this hand is the sturdy muscles under the urethra. It just like withers. It's like it's just আগের মতো যতটা strong ছিল অতটা না. So that's why when you do like hachi kashi or you know, like kanna maybe even when you do that, that's why the bladder is not well supported. It starts to leak urine. Okay. So, I mean, I don't want to go too much into treatment. I'll talk very briefly about it just because I want you all to know that, yes, this happens after having a baby. Yes, like কত মাদেরকে দেখে আসছি that this happens, like my auntie, chachi, everybody has this happen, but that doesn't mean you have to live with it. So I want everyone to know that there are treatment options available and just which kinds they are. If you all are really, really interested in knowing exactly what the treatments are, I'm happy to do another session, but for today, I'm just going to briefly outline. So basically this little tiny, like একটা knitted জিনিস, দেখছেন এখানে. So what we use is like we take that and it's a surgery. We surgically place it under the urethra, the tube that connects bladder to the outside. We place it under here, okay, and then kind of lift it up. So over here, this is right under the bladder. Now that we place this tiny little thing here, it just gives the bladder more support. I know বাইরে থেকে if you're like coughing or sneezing, and if there's any like পেটে যদি চাপ পড়ে or something, then you don't leak urine. Again, we don't need to talk about exactly how it's done, but I'm just saying there are ways to treat this. Okay. And this here is a cartoon of this woman doing a couple of or getting herself in position to do a couple of pelvic exercises. You'll be surprised a lot of times, especially like after delivery, if you're like younger, and when I say younger, I guess I mean like in your 20s, which I'm guessing most of you are who've had children. Basically, this teaches like কোন type of like muscle exercise করা যায় to make it so that everything is like stronger down there. And we can have another session about it, but that's just another option. And this here, I realize it's just like a photo of like an injection, but we can literally like inject the urethra. So যে tube থেকে like the urine comes. So this is the bladder, the tube outside. You can actually inject some material into that urethra to make it stronger. But anyways, we can talk about that another time. I just want to make sure that I send you guys home with some like really basic take-home messages, which is pregnancy and then delivering the baby causes for there to be loss of support for the urethra, which is where the urine comes out of. And a karone, you end up having leakage of urine when you're laughing, coughing, sneezing, like, you know, laftawa, you know, things like that. So just want to make sure that I at least just cover those basics. Like that's how this happens. So I thought this was a funny photo. It probably isn't, but this is a cartoon of a bladder, and this is like if you're driving on a highway and like beside it, like you see an exit and it says like "Welcome to accident," which means accidentally losing urine. Anyways, so now I want to talk about this thing called prolapse. Okay, and that is probably something that is less commonly addressed, and I'll talk about why I think that is, but also the importance of us talking about this. This also goes back to childbirth and the pelvic floor muscles. So I showed you guys this diagram before. This is that bone, like this like hard bone that you feel. That's exactly what it is. Okay, like peter tole. Right behind it is the bladder. Okay, where the urine is. Behind it is the uterus, where the baby grows, and behind it is the intestines. And remember when I showed you here, okay, same thing. Intestines, uterus, bladder, and these are all of the muscles, these muscles down here that hold everything up, okay? They literally lift everything up and keep it there for you, okay? So now what happens when women, oftentimes this happens with aging, but often in women who've had many children. So I want you all to look at this diagram on the left. Yes, your left. So again, bone, bladder, uterus, intestines. I feel like I've said that a million times. Bone, bladder, uterus, intestines. So the uterus, it's like way up there, very high, right? Now let's look at this picture. Where is this uterus here? It's all the way out. It's like basically out of her vagina. And I want to show you or tell you guys what ends up happening. A lot of times you might think something like, I feel something down there before, especially like gosole or something and that you didn't notice before and you're feeling it now. Oftentimes, like my husband will feel it. A lot of patients also say it like যেমন ধরেন like ব্যথা করে না exactly, but একটু irritating, and যেমন ধরেন like আমার ভিতরে some kind of a ball. It like feels like a little ball. অনেকজন straight up also tell me, I feel like there is something in between my legs, like another leg in between my legs. So that just tells us how severe this can happen. Basically, what's happening is that these muscles down here and here, after things like injury, I don't want to say injury. I mean, I guess it is injuries because when you're having a baby, that baby is tearing through a lot of the muscles here. Okay. And after those muscles get torn and after you have all of that trauma, they get weaker, right? Like if you think about it, if you broke your arm and then like had a cast on it, after you take the cast off, like right away, are you going to gain the same functionality as you did before? No. And what happens with after deliveries is that the same function that these muscles had before you had your kids, probably they're not as strong as after. Or yeah, I'm sorry. They're after having children, these muscles down here are probably not as strong as they were before. Okay, not like when you were a teenager. It happens. Does this mean we should stop having children? Obviously not. But this means that all of these, if you are somebody who has been experiencing any of these symptoms, it's not in your head. You're not crazy. Okay, this is a real thing. So I want to show you in this diagram here that mache mache, it's in this photo here, the uterus is all the way up there. And then it's like aste aste coming down. Do a lot of women go straight from this kind of picture to all the way this? No. Does this happen in all patients, all moms who have babies? Also not. I have seen, Janin, like I have seen patients, like women who've had one baby and had their uterus like falling out after just the one baby. I have also seen moms who have had 9 children and don't have anything. So অনেক সময় এটা হচ্ছে like genetic ব্যাপার, like আমার নানি দাদির যদি এরকম কিছু হয়েছে, I should expect that like after I have my first or second child, I should also expect things to fall. It can happen. It doesn't mean it happens to everybody, but it 100% can happen. It just happens more in women who've had more children. So just to, again, I'm just telling you all of this just so you're aware. Going back to how does the baby do this? I mean, think about it. The baby is passing through. So now it's at like the bottom of the uterus, okay? And now it's like completely passing out. On its way out, it's injuring the muscles that hold everything up, right? Like it's injuring these muscles. So that's why, that's how I describe to like patients and my loved ones how this exactly happens, because it sounds like it's a big deal. It sounds like, oh my god, everything is coming out, so does this mean I should not have children anymore? That's not true. And does this mean that I should not have vaginal deliveries and have C-sections? 100% no. There are many risks to C-sections, and also C-section or not, just like garbo avasthai, look at how much this uterus is already doing to the bladder. It's putting a lot of pressure on the bladder. So no matter what, pregnancy will have some effect on the muscles down below. And I just want to make sure that you all are aware of what kind of like effects there are down there. Again, just like for urinary incontinence, I'm not going to talk too much about the like treatment options. Just want to say that yes, surgery is an option, which involves removing the uterus. And also in my line of work, like it's not just removing the uterus, but it's also making sure that these ligaments here are also strong too. So that way, even uterus like fera poreo, that things don't drop out, which that also happens too. And I'm happy to talk about it in another session. But the main thing would be to remove the uterus if that something like this happens, and we do that surgically. We don't need to talk about surgery today. There are just some other little options here that I just want to show you, and I can dedicate a whole extra session on what each of these things are. But basically, এই জিনিসগুলো হচ্ছে like a couple of plastic devices that আমরা ভিতরে যদি ঢুকাই, ভিতরে ঢুকানোর পর everything that was falling out, যেমন এই ছবিটাতে দেখছেন, the uterus is like all the way up here, but that's because we took this plastic device that is compatible with the body. Any old plastic device কিন্তু চলবে না, because I have seen some really crazy things that people have used in order to keep things lifted. And I that is not the message I want to send home. But there are some plastic things that you place on the inside. Bhitori ঢুকানোর পর, you like the uterus that was before falling out, it was like all the way out, is now lifted up. It's great for somebody just, you know, who really feels like things are coming down and is very irritated by it and just wants something fixed but doesn't want surgery right away. Again, I'm just introducing the different kinds of treatment options that are available, but I 100,000% please ask you to talk to your doctors about this first, so that your doctors are aware of what your concerns are, because I think that that's very important. I'm just here making sure that you are all well educated and informed about this, but in terms of actually seeking like guidance for treatment, I want you to talk to your doctors about it. Very briefly, I just want to say pregnancy and then delivery causes for there to be loss of support for the uterus. And then like slowly comes back down to its normal size, but all the other muscles that were affected with the delivery of the baby, they don't always go back to their baseline. They will likely not be as strong as they were before, which is why it's very important that you all like check for these symptoms. Like, are you feeling like there's something falling down? Do you feel like there is like an extra pressure inside of your vagina or between your legs? Because if you do, it's not like it's not another morning. Like it's real. It's a real thing that's happening. And you know, I feel like this next part I think is so important, because we want to empower you to be your best self before and during motherhood. And I think so many like these two topics that I talked to you about today, I feel like আমাদের culture and আমাদের community, it's very like, oh মা হলে এরকমই হয়, বাচ্চা হলে এরকমই হয়. And you know what, even if that's true, which I said, both of these conditions happen more in moms who have babies. Even if it's true, not everything is just part of being a new mother. Even if it is, that doesn't mean you have to live with it. I want you all to be empowered enough to know that, acha, this thing happened because I had a baby, but আমার ভালো লাগছে না and I want something to be done about it. Just saying none of these, leakage, like hachi kashi dile, like panty পেশাব করা, that, or feeling like there's something down there, just সবকিছু সব যে নেমে আসছে, these are not life-threatening, which is a good thing. Like your health will be fine. It is not life-threatening. Nothing is urgent. We don't do any of these surgeries like in the middle of the night, in an emergency fashion. We don't do that. However, just because it's not life-threatening doesn't mean that it's not ruining আপনার like life quality, right? If you're constantly worried about, oh, আমি দূরে যাচ্ছি for vacation, but আমি জানি হাঁচি দিলে or কাশি দিলে I will pee my pants, so I'm going to pack extra clothing, extra pads, it's a যন্ত্রণা, right? Like who wants to live like this? And I think that so many times our moms, chachis, like daddies, everybody's just been told like for generations that বাচ্চা হলে এসবই হয়, just মেনে নিতে হয়, which is I am here to tell you that not everything is just about মেনে নেওয়া, and that if something about your body physically and Janan, mentally too, if something is bothering you, I think you all owe it to yourselves to at least have a good and thorough conversations with your doctors about it. So I think that that is the biggest thing that I want to send away with you. I'm super very, very happy that this is being recorded. So আপনার টেনে দেখতে পারবেন, or like you can rewind and see these photos again. I think that that's what's very important. There is this, and I want to share this with you. It might be a little bit difficult to see on the screen, so I'll make sure that I have us at Her will actually email this out or send this out to all of you. But this is literally a questionnaire that doctors we use to see how much do our patients know about prolapse, which is like everything falling out, like your uterus falling out, and also about incontinence, which is the leakage with the laughing, coughing, and sneezing. And I want to ask you all, I want to challenge you all to take a look at this and see how many of these, I'm not going to give you an answer key. I want you to think about each of these statements and really think about it. Think about what you think. Do you agree, disagree, or don't know? I especially would challenge you to the next time you see your gynecologist, why don't you take this with you and you both can have a conversation about it. I think it's very important because this helps us identify where there are gaps in knowledge. And I will like lose it. I will be besides myself if I were to counsel my patient and my patient like like appointment report I will not be okay with that. So I'm all about making sure that anybody that I like teach something to, especially my patient, that they know exactly what the next steps are. So I think that using something like this helps you stay in check with yourself and also helps you like really further discuss with your doctor about whether or not you have these symptoms. So I think it's important. I'll make sure I send all of these out to you. Okay, so I know that this was a short session. It was pretty, informal, but I really hope that you gained something from it. And please, if you have any other questions or if you want to access some of the documents that I had today other than this video, I'm happy to share. Okay, so I'm really glad to have been able to do this for you. Again, this is a very big topic. I tried to shrink it to the most super duper basics that you all should know, especially those of you, not even just for the moms, but also those of you who are thinking about getting pregnant or, are in a relationship and might have children one day. We want you to be your best self at all times. Okay, so very glad that I had this opportunity, and I hope to hear from many of you soon. Okay, thank you.